Welcome to NCLEX Med Hack number 9. Today we're mastering a critical skill for your nursing practice, the 5 Rights of Delegation. Delegation isn't just about handing off tasks, it's a clinical judgment that protects your patient and your nursing license. Knowing when it's safe to delegate is key to your success. Hi there, future nurses. I'm Nadi RN. Mastering the 5 rights is non-negotiable for the NCLEX and for your daily practice. Let's break down the framework you'll use every single shift. There are 5 rights we must check before we delegate any task. The right task, right circumstance, right person, right direction, and right supervision. Keep these in mind as we go. First, look at the task and the situation. Is this task appropriate to delegate according to your state's Nurse Practice Act? And most importantly, is the patient's condition stable? The right task must be appropriate for the team member. The right circumstance means the patient is stable and the environment is safe for delegation. If the patient is unstable, the RN stays. Next, look at your team. Does the UAP or LPN have the specific skills needed? You must also give clear instructions. Don't assume they know what you need. Communicate the expectations clearly. Right person ensures the staff member is competent. Right direction means you provided clear, concise, and specific instructions for the task, including what data to report back to you. Finally, remember that delegation is not abdication. You are still responsible for the evaluation. You must monitor the task and the outcome to ensure the patient's safety. Right supervision means the RN provides monitoring, evaluation, and feedback. You are accountable for the task being completed correctly and the patient's well-being afterward. Let's put this into practice with a classic NCLEX scenario. Think about which of these tasks requires the specialized clinical judgment and specialized knowledge of a registered nurse. The RN is caring for 4 patients. Which task can be safely delegated to the UAP? Choice A, teach a patient how to use an incentive spirometer, or choice B, obtain vital signs for a stable patient before breakfast. The correct answer is B. We can delegate vital signs for a stable patient. Choice A is wrong because teaching always requires the RN. Just remember the acronym EAT. RNs do not delegate evaluation, assessment, or teaching. Exactly. Vital signs on a stable patient are appropriate for a UAP, but remember, any task involving evaluation, assessment, or teaching must stay with the registered nurse every time. Safe delegation is the hallmark of a great nurse. Keep practicing these hacks and you'll be ready for your boards. I'm Natty, and I'll see you in Med Hack number 10.